Thank you, Mr. Speaker. I have 3 issues. Maybe to join colleagues, I am one of those who are very happy with the Minister for Health. It is very rare for a minister to come and provide a solution. They will be coming here to cry. The 3 issues. First, we've been investing money under the Minister of Technology, money for vaccine. We are told during COVID that was not the only area that we are preparing for all other problems. So can we be told what Dr. Ministerial's group have done with all the money that we have put there for them to develop vaccines? Because they said, you forget about COVID. We are just developing and you will have vaccines for everything. That's point number 1. And then this day where we put the money. So far, 732 billion. Because you remember they started with the vaccine during COVID. They are one of the groups. Is that one area where they are also going to help us? And finally, Mr. Speaker, the point he makes about Congo, because we interact with Congo a lot. So the question, I have visited Nairobi sometimes, even when they hear a rumor, they begin testing everybody entering from Uganda at the airport, do we have capacity and is it necessary, because this is your area, to begin checking people who are returning from Congo and those who are going? Including, by the way, we have now soldiers who are fighting there. And each fight has brought problems. You remember, we are now paying 1 trillion for plundering. The other day they came with the Congolese women. So are we sure that when they are returning, we check them thoroughly, such that they don't become a conduit for some of the problems you are dealing with? Thank you, Mr. Speaker.
Thank you. Honorable Nambooze.
To join colleagues who have commended the Minister for Health. Forever sounded like a far-fetched matter. In fact, some people had invaded Uganda. To some, it sounded very urgent and important. Of hand washing, simple as it sounds, seems to be the miracle we need to, all the time, the hands among ourselves is a culture. I think it is.
Thank you, Right Honourable Speaker. I want to thank the Honourable Minister for the concern about the virus, monkey virus. Right Honourable Minister, we are so grateful for the work you are doing. And I just have one concern. As Dr. Yume was saying that at times, the members of parliament boycott they are not boycotting, but at times they confuse people concerning vaccines. Parents are so much worried about the multiple vaccinations which are done on their children. And this is a zoonotic disease, which can easily be controlled if we alert the community, because here in Uganda it has not yet saturated so much, and we don't have the monkeys are not so common, more especially. You just listen to me. And the African rodents, they are not so many. This is the disease which we can control by giving public. We can go to the public and we inform them, we educate them, we health educate them on how to control this disease. I'm not boycotting the vaccination, but we can't say that every new disease which is going to be coming needs to be vaccinated, because the parents are so much worried about the vaccinations which we are giving to the children in schools. Otherwise, I thank you so much. And when you look at the current situation in children today, there are increasing numbers of anaphylactic reactions. Children are having allergies of different cases, so we just have to look into how to prevent diseases than giving new vaccines all the time. I thank you and I appreciate your work.
Honorable Singo Matom, Honorable Musana.
Thank you very much, Right Honorable Speaker. I also want to join the rest in thanking the Minister for the statement. But Right Honorable Speaker, my observation over the years is that each time we have had an epidemic here, other than the coronavirus, the source has been Congo. Each time we have had an epidemic here, the source has been Congo.
Honorable, we have Congo, then we have DRC.
DRC, Congo. And Right Honorable Speaker, and where? And Right Honorable Speaker, I need protection. Right Honorable Speaker, and each time we have had these epidemics, the methods to combat have been more or less fire brigading. And so, address the problem, immediately it's finished, sit back and relax, and wait for another one to come. Does the Minister want to tell us which plans she has in the ministry for a sustainable, reliable mechanism of addressing the problem of epidemics as and when they come?
Thank you. Honorable Ssemujju.
And Mr. Speaker, we are aware that we have several rebel activities as a result of the M23. There are several people crossing the border points, moving from DRC, coming into those districts that border DRC. And currently, in my district, we have several people who are coming from DRC, coming to Kagadi as a district, and then they are being moved to Changwali refugee scheme. Now, Changwali camp. Now, Mr. Speaker, I don't know how the minister is ready in mitigating those other issues that may come in, well knowing that the source of problem for our country, and together with a number of epidemics, are coming from these border points, well knowing Kasese, Bundibujo, Kagadi, and all those areas. Is there any mechanism the ministry is putting across in managing this cross-border movement as a result of the M23 and the other rebels? Thank you.
Thank you, Honorable Guzuri. I conclude with Dr. Bwana.
I'd like to thank the Honorable Minister for Health for the comprehensive report, which is very informative. However, the Honorable Minister did mention the various ways through which the virus spreads. And then she went to the extent of mentioning the incubation period. That is 7 to 14 days. According to our training, we are aware that viruses can survive even outside the host. And in this case, I want to give the example of the foot and mouth disease virus, which takes about 6 months for a place to be declared FMD free. In this case of Mpox virus, I think the minister has not informed us. In the case of contamination, how long does a contaminated place be free of the virus. We need that information for purposes of control and prevention. Secondly, Right Honorable Minister, the composition of the team that is already on ground trying to contain the virus from spreading. I know very well in the recent outbreak of COVID-19, it was basically the health professionals who handle or contain the situation. What arrangement is there for the veterinary professionals, given that this is the mpox virus, or where most of the animals are actually harboring the virus? I thank you so much. Information from Dr. Yume.
Dr. Yume.
Right Honorable Speaker, I will speak to the issue of vaccines. And several times when vaccines come, some of us in this House, leaders, decampaign the vaccination process. And yet we know that the biggest public health intervention to disease has been immunization over the years. And we have eradicated rinderpest and smallpox in 1980. Now, one thing that drives us to get vaccinated is fear. But when we are coming up with a malaria vaccine, I think it will be introduced shortly. But because malaria is endemic, the turn-up will be very poor, and we waste vaccines as a country. Yet we are supposed to procure them, they get wasted, and it's a huge cost. What drives us is fear. And maybe I'll talk to the minister that in her next submission, she can smuggle in maybe one of the side effects as erectile dysfunction or impotence. I think it will drive us men to ensure that the turn-up for vaccination is... it's one of the biggest things we fear, Right Honorable Speaker. Otherwise, thank you very much, Honorable Minister, for your presentation.
Appreciate the honorable members for their questions and concerns. I want to start from the point that was raised by...
Honorable Naomi, procedure. Honorable Naomi Kawashare.
Thank you so much, Honorable Speaker. Honorable Speaker, it is very rare.
As long as you're ready to defend yourself before Honorable Yon, so then we shall give.
He has given a go-ahead. Right Honorable Speaker, allow me, first of all, to start by thanking this Parliament for appreciating the work we do, but also for the support that they give to the health sector. Over the years, since the year 2000, when we had the first Ebola outbreak, we have been building systems. So I want to allay anxiety. All these things you are worried about are in place. That is why we were able to detect the 2 cases in real time. Otherwise, if we didn't have systems, Right Honorable Speaker, we wouldn't have detected. In addition to the quick detection, we have built very strong laboratory systems, surveillance systems, risk communication systems, and we are moving. And one of the issues why we did not come out at that time to declare an outbreak of monkeypox, we said we are just out of Ebola. We are just out of COVID. We come and make another declaration. So we just said we have cases. And one most fundamental issue was not to disrupt trade among the population and to cause scare. And we don't want you to be scared. We are handling the cases. I actually, during an engagement with members of Parliament, wanted to meet the members of Parliament of Kasese, but they were in a hurry. We wanted to bring it to their attention and just allay anxiety, because the country must move on and trade must move on. Uganda is signatory to the international health regulations, and whenever there are outbreaks, we do not restrict movements. We don't. We have what we call port health.
Port health is a system where we carry out routine, it is part of our health system, surveillance at the border points of entry. The people of Kasese will testify there are screens there, there are people, there are computers, there are vaccines at the border posts of entry. And many others, Malaba, where they are all there. So please let your anxiety cool. The Ministry of Health is in control. Right Honorable, the issue of availability of vaccines. You know, once an outbreak is declared a public health emergency of international concern, the entire international community starts mobilizing resources, including vaccines. So even the production of vaccines will go up, but it may not be adequate to cover everybody. So they will start with most at-risk areas. And that is the importance of declaring a FEC whenever there is an outbreak. So the limited availability of vaccines will be addressed. However, in my statement, I did not say that vaccines are under development, as alluded to by Honorable Otala. I said they are awaiting licensure. The research was concluded long ago. The development was concluded. The one of the US is waiting approval, and then the rest of the vaccines are waiting licensure. And immediately that discussion is concluded, the vaccine production will go up. Coordination between African countries. We have the African CDC that coordinates us, and in my statement I clearly said it was the African CDC that announced first a continental emergency, and the continental emergency was referring to the African continent, that there is an emergency, and they are coordinating us. However, specifically within East Africa, we also have our East African CDC that is headquartered in Kenya, and it also brings on board the East African countries together. We have our fora where we sit and discuss, and in the next 1 week or so, we shall be in Congo Brazzaville to discuss. So the coordination is ongoing. Now, the border point at Orom and the kidney failure. Right Honorable Speaker, we are sitting on a time bomb of non-communicable diseases, a time bomb. 25% of our population has high blood pressure. It is not related to the outbreaks or the vaccines. It is related to our lifestyles. And it is something that we must handle urgently. We are preparing documentation on that, including burning unsaturated fats. You see this business of people eating fried things on the roadside, chips, whatever, Blue Bandy, whatever, you know, those things, they use the same oil over and over and over. We are at risk. And the young people are now most at risk. And that is why he's seeing cases, but he's thinking it is due to the outbreaks. No, it is our lifestyle. We need to address it, including other non-communicable diseases. Right Honorable Speaker, I don't want us to worry about village health teams and community and information. It is already with them, and they are doing what is needed. Hastening approval of the vaccines, it is ongoing by WHO. The issue of eating monkeys and so on, Right Honorable, I don't know the communities that eat them. We've talked about these things. I think we need to continue to educate our people. How long does the virus stay on contaminated surfaces? Right Honorable Speaker, for monkeypox, actually the time period is longer. The virus can survive for up to 15 days under optimal conditions, 15. And that is why in my statement I emphasized avoid sharing clothes and so on. But on hard surfaces, between 24 to 48 hours, that is why we must encourage cleaning with sanitizer and making sure that we wash our hands. The Ministry of Health works through what we call a One Health approach for the purpose of the veterinary doctor. A One Health approach brings on board Ministry of Health, MAIF, Wildlife, Water and Environment. And that is how we handle outbreaks, through a One Health approach. The complications of the vaccines and in regards to erectile dysfunction, my chair emeritus will discuss that in details with the men. But for now, I want to reassure you that the vaccines are safe. Chair, the issue of disinformation and misinformation, we have already started addressing. And I started addressing this when I requested you to give me members of parliament. I have been talking to them about vaccines. We are engaging other groups before we go full blast to the communities. But honorable members, Uganda has only 14 vaccines, 13. The malaria vaccine will be the 14 on our routine schedule. Some of those countries, like the US and where, have 54 plus vaccines. What is our problem? The vaccines have kept us alive and well. We eradicated polio. You're no longer seeing people with lame legs. We have eradicated many diseases. We are in the process of eradicating. Can I continue talking? And many others. So when I see people saying we have too many vaccines, I even wonder, you have too few. If we had many, even the issue of flu and whatever, you would not be experiencing. So don't worry about these vaccines. They are good. They are cheap. They prolong our lives. Instead of bringing in family planning and so on, if we had more vaccines and children were living longer, you would have women having fewer children. So let's embrace vaccines when they come, instead of giving negative information to people about the vaccines. I will not answer for Ministry of Science. I think we can invite Ministry of Science to come here. Right, Honorable Speaker, I want to conclude. The issue of mandatory hand washing, contact, handshaking, all those things are in the Public Health Act. The challenge is enforcement. When we started hand washing during COVID, everybody participated. All these diseases went down. Now it has risen. Lastly, on the issue of resources. Right, Honorable Speaker, I have requested over and over again whether we can have a budget that is ring-fenced for epidemics. I have never gotten that. Now, whenever I get an epidemic, I mobilize partners and I go into mobilizing resources. It is really hard. I need to be supported in that area. I thank you.
Thank you. Now,
we could produce more copies for members of parliament so that members of parliament, especially from the 17 districts which border DRC, can be part of the mobilization to educate the masses. Then second and lastly, just to reassure the honorable members that the process of vaccine development is so rigorous that there should be no fear among the members about vaccines, because vaccines go through a process of preclinical and clinical trials, and then WHO has to go through approvals, checking efficacy and the effectiveness and safety. So we would want to request members of parliament not to fear vaccines, because by the time Minister of Health says we have approved this vaccine, it has gone through lots of trials. The Speaker says there is no time. So I just wanted to reassure members that the vaccines that we use are safe and efficacious.
thank you.
I thank you very much.
Honourable Minister for Tourism.